Good afternoon, everyone. So without question, these are truly uncharted waters that we are navigating COVID-19 together. This, as you know, has been an extremely busy week, and we are seeing some significant changes within our province. For example, we've seen changes to visitation in some of our long-term care facilities. We've seen operations at bars and restaurants change. We've seen education suspended within our schools and closure within our daycares. We've seen the population, the people of our province, make significant changes in the way they socialize with each other. So I want to take this moment to say thank you to the people of our province for cooperating with the guidelines and the recommendations that we've put in place. Today we will introduce additional changes around the Public Protection Act, changes that we feel are necessary at this time. Minister Hagee will talk about those changes in a moment, but first, there are a few things that I would like to address. There is no doubt COVID-19 is having a significant impact on our healthcare system and our economy. As you know, today the federal government announced temporary restrictions to all non-essential travel across the United States border. However, we know essential travel will continue. Also, an $82 billion package was announced today, and this means more support for workers and businesses as we navigate over the weeks and possibly months ahead. The package includes $27 billion in direct support to Canadian workers and businesses and some $55 billion to allow tax payment deferrals until September for individuals and corporate taxpayers. Included in this is a new emergency care benefit that will provide workers with up to $900 biweekly for up to 15 weeks. These new programs for workers, including the self-employed, and is meant for anyone who is sick, quarantined, self-isolating, or carrying out caretaker duties. So applications for the benefits will be available in April of this year, and you'll be able to access these online and by telephone. A temporary wage subsidy has also been announced and will support businesses and prevent layoffs within our province. As you know, the subsidy will last for 3 months and will equal some 10% of remuneration paid during the period. This could be up to $1,375 per employee, $25,000 for the employer. Employers can also benefit from the subsidy, include small businesses, which is important for Newfoundland and Labrador, but also important, the nonprofit organizations and charities are included. There's new changes to allow greater flexibility for taxpayers be able to file on June 1st, 2020 and defer payments until August 2020. For Indigenous governments, the Government of Canada has created some $305 million to support Indigenous communities to address immediate needs for Indigenous communities. The Canada Child Benefit changes up to $300 per child for the 2019-20 year. Also, GST credit changes boosted to $300 plus $150 for each child. Now, this afternoon we had a long conversation with my other Canadian premiers and with the Deputy Prime Minister, Chrystia Freeland. One of the things that I stressed again today on my call, as I did last week with the Prime Minister, is that this is not a one-size-fits-all. Meaning what works in one province or one territory does not necessarily mean that it will work for Newfoundland and Labrador. And in saying that, discussions on the federal and provincial level, as they have been extraordinary. This is not a time for politics. It's a time for cooperation and collaboration. Canadian premiers will continue our open dialogue with the Deputy Prime Minister on a daily basis. These are tough times. We saw today oil reached historic lows in our province, and we're seeing investment being deferred on many projects. My message to the federal government is it's urgent to get this money moving. Additionally, our government will be extending a 3-month deferral on loan payments to all tourism, culture, industry, and innovation clients with business loans with Innovation Business and Development Corporation. The COVID-19 situation continues to evolve, and we will continue to make changes. And we will continue to put protocols in place, whether it's on an hourly, daily, or sometimes on a weekly basis. We know that some of the swift decisions may not always be perfect, but this is about preventing the spread of COVID-19. We're making these changes with your health and safety in the forefront. We have to work together. We have to continue to wash our hands, practice social distancing, and ensure that health and safety of ourselves and our loved ones is a priority. Once again, I would like to thank Dr. Fitzgerald. She's been working tirelessly on behalf of our province. And as Premier of this province, I appreciate the work she's doing on behalf of our government, on behalf of Newfoundlanders and Labradorians. At this point, I'd like to turn it over to Minister Hagee, who has also been working tirelessly on behalf of our government and behalf of Newfoundlanders and Labradorians. It's been a team effort. So to you, Dr. Hagee, thank you for being here with us again today, and you can make your comments on the health aspects and social responsibility. So thank you very much.
Thank you very much, Premier. This is an unprecedented time. We are guided very much by the expertise we have in Dr. Fitzgerald and her team of public health doctors. You may recall in 2018, we went from having the oldest public health legislation in Canada to some of the newest, strongest, and most nuanced legislation in Canada. So with effect today, and on the advice of Dr. Fitzgerald after multiple conversations, under the Public Health Protection and Promotion Act 2018, I have signed the first declaration of a public health emergency in this province. What that does is it enables the force of law and regulation to be applied to what were previously recommendations by an appropriately designated medical officer of health, in this case, Dr. Janice Fitzgerald. We have heard concerns about people and businesses who may not have acted as responsibly as we had hoped they would. By and large, the level of compliance with our recommendations has been high, but again, our opportunity to flatten the curve is now, and we are seizing that. This order, this declaration, enables penalties and consequences for non-compliance, and these are amongst the most severe of any of the public health legislations in Canada. For example, for an individual, for their first incidence of non-compliance, a fine of between $500 and $2,500, or a prison sentence of less than 6 months, or a combination of the two, could be incurred by being in breach of the orders that we will be announcing under this Act. For corporations, the fine would be anywhere from $5,000 to $50,000. I can't read my own physician's handwriting here. And directors in corporations would be held personally liable and susceptible to individual penalties as well. These are then multiplied for subsequent offences, and that essentially means that for every day an individual or a corporation is not in compliance, that is a new and separate offence for as long as it continues. These are significant penalties. We hope we never have to use them, but they exist, and if necessary, we will use them. From this novel decision in unprecedented times, I just want to move on to a couple of things, and probably the hardest decision that we have had to make concerns visitation restrictions for our vulnerable, our sick, and our elderly population. There is no doubt that these will cause distress, and they've distressed me, quite frankly. But again, the acute care facilities have restricted visiting to obstetric, to end-of-life issues, and to children who are admitted. The security at hospitals has been improved to reduce the number of points of access and to allow for policing of this. There will be recommendations about the size of gatherings, and we've heard through social media about bingo halls and these kind of events that continued as recently as last night. And these, in the interests of the health of all of us, must cease. Today, in consultation with the Pharmacy Board, it became clear and was announced that pharmacists have the ability to refill and extend prescriptions under their own scope of practice. And this then removes the requirement for people to go to physicians' or nurse practitioners' offices to get their prescriptions refilled. So this again will increase availability of physicians for those who are ill and nurse practitioners, and reduce the likelihood of crowded waiting rooms, and again help with social distancing. I have received communication from Canadian Blood Services. They are concerned about blood donation. For those of you who give blood, I encourage you to continue to do this in consultation with your local clinic. It is safe to do so, and we will ensure, in conjunction with CBS, that the appropriate protection and social distancing occurs. We have had significant strain on our 811 health line. We have increased the number of lines, and by the next 36 hours, we will have another tranche of 14 new RNs available to alleviate call volumes. But I would encourage everybody to go to the government website, and there you will find a self-assessment tool on our COVID-19 website. You can use that. Those are the questions that would be used by 811, and you can get the answers you need from that website for anyone with access to the internet. I would encourage you to help us use our 811 line itself in a more efficient and effective way. Having said that, I think it's now crucial that we hear from the experts in the field of public health for today's developments, and a little bit more detail about what under this declaration these orders would comprise and how they would work. So with that, I'm going to turn the floor over to Dr. Fitzgerald. Janice?
Thank you, Minister, and thanks everyone for coming. Good afternoon. I'd like to start first with just case numbers and updates. As of today, March 18th, there are still 3 presumptive positive cases of COVID-19 in Newfoundland and Labrador. The number of people tested in the province to date is 590. Of those who have been tested, 587 have been confirmed negative. And there are currently 248 people in self-isolation and being followed by public health. We've been closely monitoring the COVID-19 situation in our province and across the country. Over the last number of days, we have seen the pandemic continue to evolve. The public businesses, nonprofits, and public sector have taken unprecedented steps to ensure that we can protect the health of our population, including our most vulnerable. I thank everyone for their diligence in continuing to adhere to our public health recommendations. We have decided to take the next step to ensure that we are best positioned to protect the health of our population. Our Public Health Protection and Promotion Act has levers to ensure that we can do just that. Today, I met with the Minister of Health and Community Services and recommended that a public health emergency be declared. The decision was made in the best interest of our residents. The recommendation to declare a public health emergency does not come easily, but is necessary at this time to protect our population. We require special measures to respond to the evolving situation of the COVID-19 pandemic, and this declaration enables us to strengthen the public health measures we have already been communicating to the public. These levers enable the Chief Medical Officer of Health to be more rapid and flexible in responding to the changing landscape of COVID-19. Effective immediately, the following types of businesses must close: gyms, fitness facilities, bars, cinemas, performance spaces, and arenas. These businesses are unable to adequately meet the requirements of social distancing. Restaurants that can maintain social distancing can continue to operate at reduced capacity of 50%. Takeout and delivery models can continue as per normal operations. Public gatherings of more than 50 people are no longer permitted under this order. Gatherings under 50 people should be avoided if social distancing is not possible. Effective immediately, any travelers returning from international destinations including the United States, must self-isolate for 14 days after their return to Canada. We appreciate that many travelers have been doing this already on a voluntary basis. I want to assure residents that we are prepared and our health system is working well and as it should under these pressures. This is another tool in our toolbox to ensure that we all do our part to support flattening the curve. While we are experiencing new and emerging challenges, we know that this is a long-term situation. We appreciate everybody's collective efforts. We must continue to follow the public health evidence. Washing your hands frequently and with soap and water or using hand sanitizer with at least 60% alcohol will help you and those around you stay safe. Avoid touching your face. Stay at home if you are not well. Regularly clean high-touch surfaces such as doorknobs, remotes, and phones. I appreciate that there may be increased anxiety with the declaration of a public health emergency. I want to reassure the public that these measures are put in place not because our situation has deteriorated, but after careful consideration, we feel this is the best way to protect the health of our population and reduce the risk of spread of COVID-19. I appreciate everyone's patience and cooperation during this time. We must all work together to stay healthy and do what we can to manage COVID-19. Thank you.
Now that we've enacted this state of emergency in terms of public health, can you elaborate a little bit on what brought us to this point? We have 3 presumptive cases in the province. Many other provinces, having more, have not declared their states of emergency.
We are pretty well in the pack. I think there's several ahead of us, and as you allude to, there are others that haven't. I think I could do no better than to reiterate what Dr. Fitzgerald said. This is done for ongoing protection. There have been increasing concerns, particularly through social media and email that have been brought to my attention in the last 36 hours, of suggestions of non-compliance. I think really this is an exclamation mark, as I think the Premier said in our discussion earlier on. This is an exclamation point behind what were previously recommendations. These now have the force of regulation, they have the force of law, and recurrent failure to comply is going to cause significant risk of significant repercussions, as stated in the Act. This is done to get ahead, this is done to send signals, and this is done to allow Dr. Fitzgerald the leeway to make changes if we find particular pressure points do arise. We have 3 presumptive cases currently. It would be remarkable, if not miraculous, if we don't get more. This is the long haul. We'll be at this through to the spring.
In terms of enforcing and regulating those who are going to be compliant, who is doing that? And is there a number or somewhere people can reach out for those that they believe aren't being compliant? I know there was a number that went around earlier that we now have learned is inaccurate. Yeah,
that was unfortunately an administrative assistant in public health who has been unable to do her job because that number got out without verification. And if one thing's come out of this, the important thing is that we should have valid information and trusted information out there. And to those of you who've reached out to confirm it, I appreciate that. From our point of view, enforcement is a separate mechanism. It involves other agencies rather than health. It involves Service NL, and we've reached out to them. It involves Justice and Public Safety, and we're reaching out to them. We're looking at mechanisms to make that a feasible and workable thing. We're taking this one step at a time. The first step was to have the levers, and we believe we've got them now.
Premier Wall, just a little further to that question. It was actually Cabinet Minister Derek Bragg who was one of the first to share that number. He has since apologized for it, but do you have any comment on that and him jumping the gun and sharing what was false information?
Well, quickly apologize, the minister did. Of course, and I accept that apology. I mean, there's a lot of information that's going back and forth, and he was quick to apologize, quick to remove the site, the post that he made. So, for my part, I accept that apology. There's a lot of information and a lot of comments that are coming through social media, and the minister corrected the wrong and removed the post.
And there's been a lot of concerns today about how long this virus can live on surfaces like cardboard, and then with mail couriers. Do you have any recommendation? Should mail be in like a 48-hour quarantine or something like that before it can go out?
So what we know about this virus is that it likely can live for a period of time on certain surfaces. That will vary with the type of surface. Smooth surfaces, viruses can live, in general, viruses can live longer. On more porous surfaces, that's not so much the case. What we have to remember about a lot of mail is that it's going through a whole processing, it's being shipped, it's getting exposed to cold. So in ideal situations, the virus can survive for an extended period, perhaps for a few days on surfaces, but that's if they're not cleaned and if the surrounding environment is suitable. You know, things going through the mail, the cold, for one thing, is going to take care of that, so not a risk.
I'm curious, how long could this public state of emergency for health last?
Under the Act requires that this be reassessed every 2 weeks, and we will do that for as long as necessary. As I've alluded to, we have indications from other countries that this pandemic will persist well beyond 2 weeks. I anticipate this order being, quite frankly, renewed multiple times.
There have been a couple of reports, studies out in the past few days that suggest this is far more contagious than originally thought, that about 80% of cases may actually be hidden cases, people who aren't actually expressing or feeling symptoms. Dr. Fitzgerald, does this change, for example, your contact tracing processes? How does this affect how you're treating this disease?
So if somebody is infected with a disease and not symptomatic, that doesn't mean that they're contagious. So at the moment, what we know about this disease is that the people are most contagious when they're symptomatic, and generally speaking, it's most contagious when you're in close contact with somebody. So that still is the basis for our contact tracing at the moment.
Okay. The continuity of supply and what's being considered a necessary service, perhaps, Premier, you could talk to what you're, I'm thinking of, for example, food supplies coming across on the ferry, that sort of thing. What's your take on that?
Well, two things. One, if we address the supplies, you know, that we would be using in the healthcare sector, we address that first. I mean, Dr. Ag and I, we speak really on a daily basis about, you know, the supplies, you know, personal protective equipment and so on that our healthcare workers. I regularly check with Dr. Ag with this, but also we bring this up daily with the federal government as well. On food supplies and food security within our province, I had a number of calls yesterday with major distributors that would supply food for Newfoundlanders and Labradorians. And so far, there was no questions raised by any of the major distributors on access to for food. Of course, today with the changes that we've seen within the border with the United States, that was a big topic of the discussion today with the premiers and with the deputy prime ministers. And pleased to hear that, you know, those food services and food supplies will continue coming across that border. As you know, this time of the year, a lot of the fruits and vegetables would come, and food supplies would come from the U.S. So far, the supply chain is intact, and there's the comment made to me yesterday was the inventories are full in the warehouses, but it seems like most cupboards are full in Newfoundland and Labrador, as they're telling me that it's been very robust with the purchases that have been made around our supermarkets.
If you look at an area like the Northeast Avalon, which has a fairly large population, so far there have been no cases. These sorts of lockdowns have a significant economic impact. There are people who are losing their jobs because of this, and yet there's still no evidence that the virus is even in this area. What do you say to people who say this is all a bit overblown?
So I think at this point, we have time to get out ahead of this. We don't want to see an increase in cases like we're seeing elsewhere in Canada. I mean, that may still happen given the nature of this virus, but I think if we can put some of these social distancing measures in place, the restrictions with regard to isolation for returning travelers, where our biggest risks are. I hope that we will be able to make a serious dent in the ability for this virus to take hold here.
One of the things about that, Peter, is when, with the regular calls that we're seeing across the country, is we are actually learning from what's happening in other provinces. Today, for instance, when I spoke to the Premier in British Columbia, his story was very different. And I think any of us, if we were to share the information, what we're seeing as an example in British Columbia, we would take the proactive and the precautionary approach in Newfoundland and Labrador to prevent, to contain, to delay. And so these measures that we're taking today and the work that the medical officer is doing, the chief medical officer is doing, is really in line with contain, delay, realizing that at any time you could see a spike in positives, in people testing positive with COVID-19. That is what we're trying to prevent by the precautions and the actions that we're taking today.
The one place we are still seeing a lot of people gathering is supermarkets as they stock up on supplies, and people are worried they may be touching the same thing that either workers or other people have touched. There's things like produce. What sort of precautions should people be taking in order to, and can you give us an idea of, does the virus live on things like apples or grapes or the sort of unwrapped produce that people are dealing with?
So I would assume that the virus could live on produce or other types of products in the store, just as many viruses can. We don't have a lot of evidence on that particular question at the moment, but I think we have to behave as if it can. So my recommendation would be, again, to, if you're getting produce, once you bring it, obviously you wash your hands very well after you pick it up, before and after you pick it up, but once you get it home, you wash it very well as well, and make sure that you keep your food supply safe in that regard.
Okay, we'll go to the phone lines.
Yes, hi, hello. Hi.
Hello?
Yes, we can answer questions.
Yes.
Yes.
People have just come back from crowded airports, like in Pearson Airport, let's say, but have only traveled inside Canada. They are reporting symptoms like dry coughing, fever, and when they try to reach 811, they are told that it's not a concern and they are not being tested. Is 811 using outdated criteria, and should there be more tests being done in Newfoundland?
So right now, our testing is focusing on international travel. That is where the biggest risk is for import of this virus. Obviously, we're watching the situation closely, and if we see that change in the coming days, then we will change our testing criteria to match it.
Should it be changed right now, since we see that everything changed so quickly?
Sorry, I didn't hear the question.
I said, shouldn't it be changed right now, since we see things change so quickly?
At the moment, we are still focusing on international travel.
Oh, there was another on the line. Oh, there's another one on the line?
Hello. Hello, my name is Angel Moore. I'm with APTN National News, and I do have a couple questions. First one is, what is the province doing to help the Indigenous communities, especially the ones that are so isolated in northern Labrador and have limited accessibility access?
Well, first of all, the measures that are in place with Indigenous communities are really no different than what we would see with the rest of the province. However, we do have a committee that are meeting, and they met yesterday, as recently as yesterday, on the impact of COVID-19 and what the measures through pandemic planning would be for Indigenous communities. We saw the federal government as well today announce over $300 billion to support Indigenous communities. And in Newfoundland and Labrador, it's the Public Health Services for Nunatchivut that they are the responsibility of the Nunatchivut government. And from Indigenous groups as well as the Innu, we are working very closely with them. And so, as I said, the measures that are in place are very similar to what we would see within Newfoundland and Labrador. But we have Labrador Grenville. It was as an experience of working with Indigenous communities in Labrador as well.
So you say the measures are the same as in Newfoundland and other areas of Labrador, but wouldn't you admit that there's Indigenous people are more vulnerable due to the isolation and the past and current health conditions of people to start with? So we're concerned about what will happen if or maybe when the outbreak hits these more vulnerable populations than non-Indigenous people.
Yeah, thank you very much for the question. I think the whole of our changes over the last several days, and certainly culminating with this order here, this declaration, are aimed at protecting vulnerable populations, be they Indigenous or seniors on the island or wherever. And they are, as Dr. Fitzgerald has emphasized, focused on containment, identification, and tracking. Those are the key resources to prevent the arrival of the virus in any community, and certainly in Indigenous communities. Because of recent history, as it were, certainly with Nunatsiavut, we have, through Labrador Grenville, a very collaborative arrangement with public health expertise, which they have and which we can also bring to bear. And we have similar parallel arrangements through First Nation Indigenous Health Branch that go to speak to the needs of Innu Nation in both of the two main communities. Again, our emphasis is on containment and preventing the arrival of this virus there.
Dr. Fitzgerald, you touched previously, and I know Peter asked about grocery stores in terms of touching produce. I'm just wondering if that falls under gatherings of 50 people or more, what's being done there?
So it's not, if people are spread out across the store, it's not like a mass gathering per se, right? So it is important. Obviously, people still have to be able to shop for their groceries and have to be able to eat. So these are essential services that must continue. And, you know, grocery stores have certainly been enhancing cleaning, as many businesses have been doing. And then we have our own personal responsibility to make sure that we wash our hands and clean any surfaces that we touch, you know, clean down the carts and things like that. So, yeah, so we do, even though, you know, we will see multiple people in a grocery store, these are still things that have to continue. So we have to find that balance.
I'm not sure if this is for Mr. Haggie or for yourself, Dr. Fitzgerald, but is there a direction for ambulance workers, for those first responders, in terms of picking people up with symptoms? I guess there's some confusion in terms to, do they call 811? We know 811 has a backup right now. If they do transport somebody who's experiencing symptoms, do they self-isolate after?
There is a fairly robust protocol with our first responders to deal with the issue of someone who may be COVID-19 positive. What we have said is, if you ring 811 for advice, that's one thing. But if you call 911 because there is a feeling that you are sick enough that you need immediate, urgent medical attention, and you have a history of traveling or have been exposed to COVID-19 and are currently self-isolating, you need to make that information available to the dispatcher, the 911 dispatcher. There is PPE then available for the first responders, who will then collect you and bring you to the emergency room, who would have been warned that you had these exposures and potential risk, and they would in turn be able to take precautions. There is then a cleaning protocol for the vehicles and the equipment. So the short answer is yes, we've got that one covered. As yet, we have, as far as I'm aware, as of today, not had to use that. The cases that Dr. Fitzgerald has referenced are all being managed at home, and the contact tracing that's going on currently has not turned up anybody who is positive or anybody who is ill. So as yet, the first responders have not had to adopt those measures. They're there.
Dr. Fitzgerald, you may have answered this already, but once you contract this virus, can you contract it a second time, or do you become immune like a chickenpox type of thing?
So the jury is still out on that one. They're still investigating it. Yeah, we don't, and we probably won't know the answer for some time on that. Just, you know, after, usually you don't find those things out until after many months.
And there's been lots of concerns around HMP and a possible breakout among these facilities. What preparations are underway right now to prepare facilities and these penitentiaries all along the province?
We have the jurisdiction currently for health in HMP still lies with Justice and Public Safety, but there's a transition that is scheduled to take place on the 1st of April. So Eastern Health particularly has been working on those kind of things. There are arrangements in place for example, legal counselling to be done remotely via telephone or via video link. There are measures in place for cleaning and hand hygiene, and there are measures, as I understand it, for social distancing. So my understanding through folk in corrections is that they have started down that road. If you want more granular detail of what's on the ground at the moment, I would probably suggest you talk to Justice and Public Safety about those. We will have full and complete knowledge of the situation on the 1st of April when we take it over as a department.
This is for Dr. Fitzgerald. I was wondering if we could get a more detailed update on the 3 presumptive cases. Are they still experiencing mild symptoms?
Yes, so all 3 of them are recovering at home and are experiencing fairly mild to moderate symptoms. Yeah.
And it's been 3 to 4 days since the first presumptive case. So when do we hope to hear back? When might we hear back about the results?
I hope to hear back this evening, but again, it depends on weather. Lots of times, right?
Nurses have expressed concern, as have all healthcare workers, as to their own safety, and I understand that some of them it's been suggested they wear surgical masks, which according to SARS protocols from years ago are insufficient to really protect anyone around the virus. You had a teleconference today, I believe, with the healthcare workers' representatives. What came of that teleconference?
The teleconference actually finished moments before we came into this room, so I've only had a very superficial briefing. We have an inventory of PPE. We have orders in and are expecting those imminently, both through the provincial supply chain, the shared services, and we have got access through the National Emergency Strategic Stockpile to augment those. The PPE is available. In terms of the granularity of the conference, arrangements have been made to have regular updates and regular interface with the unions that sent that joint request in and had the joint meeting today.
And I realize that it's all done electronically now, but is there any medical issues that would arise from continuing with the Liberal leadership campaign?
I guess that question is for me. I know the current leader is in good shape, I think, so not that I'm aware of. I mean, obviously, you know, I have not been talking or been involved in this process, as you know, and but as I said, as far as I know, there's nothing to, at least medically, to interfere with any decision that they would make at this point.
We're hearing concerns from people who have some of the symptoms of COVID-19. They're calling 811. They're being told, you didn't travel internationally, you haven't had contact with someone who's tested positive, you don't need to be tested. What's stopping us from testing those people? And how can we say that there isn't any community transmission going on if we're not testing people like that to know whether or not they may have inadvertently been exposed and this may be being passed through the community?
So every test that's being, so we do the nasopharyngeal swab, or the swab that goes up your nose. That swab can test for many different things besides COVID-19. So we can test for influenza with that swab. We can test for para-influenza, other respiratory viruses as well. And COVID-19 has recently been added to the panel of tests that are done on that swab. So everybody who presents with an influenza-like illness who gets a swab done, even without risk factors for COVID-19, is getting tested for COVID-19. at this time. There are other people who have had travel history who we are specifically testing for COVID-19. They are also getting tested for all of those other respiratory viruses as well. So we are testing, and anybody who's getting a swab done for influenza-like illness is getting tested for COVID-19. So that's one of the ways that we would expect to pick up community cases. And in fact was how they picked up the first community case in BC, by doing that. And we are testing anyone who is having severe respiratory illness who is getting admitted to hospital. If they're getting swabbed, they're getting tested for COVID-19 as well.
But there are lots of people who the symptoms never get severe enough to warrant hospitalization. What's stopping you from being able to do much more widespread testing?
So we have to be careful, as you are, I'm sure, no doubt aware. There have been nationwide concerns about the supply of these swabs, and while we do have supplies now in the queue to come, we want to be as judicious as possible to make sure that we are finding the people who are most at risk for this disease before we to test for them, which at the moment is people who have traveled or contacts of cases, actual cases. If we start to see that trajectory change, if we start to see community transmission, we start to see cases in people who hadn't traveled with our other screening, we will certainly have to consider screening people with symptoms in general.
Okay, let's go to the phone lines if Marie-Isabelle has another question.
It's good, thank you.
And Angel with APTN? I will take that silence as a no, so we'll back to Kellyanne.
Oh, sorry, I'm good, thank you.
Sorry, I just thought I heard someone say they're still there. Okay. Minister Haggie, you, through the beginning of this, stressed how difficult it was in terms of restricting limitations on visiting and those things. Are we seeing that we're now, there's no visitation to senior homes? Where are we at with that? So I just need some clarification.
No, the restrictions, the severer restrictions are actually around acute care facilities because of the nature of the place. So if visitation to acute care facilities is for obstetrics, for children who are admitted, and for end of life. The visitor restrictions on RHA long-term care is one individual per day. We have made those same recommendations to personal care homes as well. And that's where we are at the moment. I know other jurisdictions have banned visitation completely from all sites. And I think that actually, at the moment, on the information that Dr. Fitzgerald and recommendations that she's made, is currently not necessary. If the situation changes, we will have to look at that again.
I'm not sure who listed them before. Do you mind relisting what is now being asked to close effective immediately? Does this include malls with retail stores and bingo halls?
So gyms, fitness facilities, bars, cinemas, performance spaces, and arenas is what we've listed.
So bingo halls are still, or is that because a gathering of 50 people or more?
Well, it would certainly be a gathering of 50 people or more.
If you can do it on the TV, on the community channel, and still get your dabber out, that's fine. But really and honestly, we don't want a gang of seniors at close proximity. If they can maintain social distancing and there's less than 50, it's still something to think about.
A lot of parents are concerned about childcare and trying to get money for saving a spot for their child. What can you tell parents about, just in trying to save money and trying to figure that out for their children?
Well, the decision that was made around the closure of childcare sites was something that, when we suspended education within our schools and closed schools, we were aware of the impact that this would have on families. So we're working with early childhood education operators right now, especially when it comes to people that we would require for essential services, especially around healthcare and others. So working with childcare centers now to see if there's a way that we can actually use the space, keeping in mind the recommendations that have already been made to use those spaces to support some of the essential workers within the province. Also realizing that the operating grants and the benefits that we from a government that we actually provide to those centers, they will continue, so they have not stopped. So, we fully expect that the employees will be treated fairly in this situation.
And then this one came from Twitter, and they say they're asking about healthcare providers like physiotherapists, registered massage therapists, chiropractors, if they should stay open, how they should operate. Do you have any recommendations there?
My understanding is that they are being advised through their own professional regulatory bodies as to how best to conduct business. They are, by and large, private enterprises. We have not any evidence yet of concerns around those. So again, I would refer them to their own professional bodies as to how best to conduct business.
One of the questions that people have is, you may have international passengers who are coming back. That usually means a domestic flight between Toronto and here. They're sitting next to people who are on a domestic flight. The person who's coming back on the domestic flight doesn't have to do any sort of self-isolation. The one who's coming back from an international destination does. Why the discrepancy there?
So the issue is not so much the flight from Toronto to Newfoundland. The issue is where they were before they took that flight to Toronto. So we know that there are some areas that have higher rates of COVID-19, and there are some areas that may not have as higher rates, but we know maybe don't have the same public health infrastructure to be able to detect those cases. So that's why the international travel is more of the concern.
The other thing around that, Peter, is one of our own airlines here, they're not taking people off international flights who have not self-quarantined for the appropriate length of time. So I think that's going to cause some challenges for people coming back, because they're going to end up in Toronto and they may find themselves unable to get on an onward flight until they've waited 14 days.
You had talked yesterday at the briefing about the number of ICU beds and the number of ventilators we have. Of course, we're not starting at zero. There are lots of people who are already in those beds for a lot of non-COVID-19 related issues. Can you give me an idea of what's our capacity, especially now that non-essential surgeries have been canceled? You know, if we started to see those beds being needed, how many do we have available, and how many ventilators are regularly available? I know those numbers are changing a lot, but kind of give me a ballpark.
Well, the best we could do is get you a snapshot, and that snapshot will change, because if you remember, one of the things we did last Sunday was to cancel all elective surgeries, and how much ventilator capacity they would take up on any given day is actually impossible to predict. So we would anticipate that that would wash out over the course of a period of a week or two. The longer the lead time before we start to see cases that get hospitalized, the more ventilators we will have available. I can give you the total number. It was 156, as I recall, yesterday. We also have the option through CapSource, which is our national capital equipment buying body, to access further ventilators. Again, that's an option we may need to exercise if the time ever came. But it's a very small subset of people with this disease who get that far. We don't actually have anybody hospitalized yet with the condition. So every day that we don't gives us more time to get more ventilators.
Dr. Fitzgerald, we're hearing many things. Tylenol is the key to take if you are experiencing symptoms, not ibuprofen. Can you clarify this?
Well, certainly Tylenol is appropriate for fever, so if you want to reduce your fever. There have been some discussions about ibuprofen and the effect of that. The evidence is not, it's not strong, but certainly Tylenol would be safe to take for fever.
And how are the current 3 presumptive cases doing? We know the first one was doing well. Has that changed in the new 2?
No, they're doing well at home.
This is another one. What guidelines are in place in regards to funeral homes and visitation there?
I noticed one jurisdiction, I think Alberta, has actually put a ban on funerals and wakes. We're not at that stage. We have had some discussions with the funeral homes organization in the event they had to look after someone who'd passed away from COVID-19, and we've provided some fairly basic information there. So at the moment, we have not made any specific recommendations. I would draw your attention back to Dr. Fitzgerald's comments about social distancing and large gatherings.
One last question from me. one of the questions that I saw here from people around shopping was plastic bags versus cloth bags. Is there any issue with continuing to use cloth bags with groceries, or is it safer and better to be using plastic bags that you can then just throw away?
So I think as long as you are taking clean bags to the grocery store and then washing those bags after you use them, I think it's safe to use the cloth bags. And then, of course, washing your produce afterwards and making sure you wash your hands before you eat, and all of those hand hygiene principles, then I think it's okay.
I know we're not at that point yet. Are we looking at extending any further labs or opening up more areas to do more testing? And are we going to start looking if we're going to need nurses that have recently retired to potentially re-register to come back to help alleviate some frontline staff? I know this work's being done in BC.
Yeah, we've opened discussions with the regulators, because that would be the principal determinant of whether or not someone was appropriate to relicense. In terms of capacity at the public health lab, I don't think we have reached anywhere near the capacity of the lab to test. There are options should that happen, and we've got some potential solutions. Again, you're quite right, these are things that are a little bit down the line.
I just have one last question. With regards to frontline healthcare workers, are any coordinated efforts being made to find a solution for their daycare needs?
That's what that was what I was referring to a few minutes ago there. We're working with, daycare operators today through the department. And, the objective here is to open up spaces to support essential workers, those that we would require to work frontline in healthcare. And those discussions are ongoing now.
Thanks, everyone.
Thank you. Thank you. No, I'm looking casual.